Hi there. Were you standing there all this time? I'm sorry. My name is Shamonia and this is Oh Wait.
I'm Alistair Williams. Before the presentation begins, take out your pens and books and let's get started.
For today's presentation, we will be focusing on pyrodoxine. Now, at the end of this presentation, each individual should be able to define pyrodoxine, give the functions of pyrodoxine, identify 6 food sources of pyrodoxine, explain the recommended dietary allowance for pyrodoxine, list 2 factors affecting absorption and 2 factors that promote absorption. Also to describe 2 biochemical or clinical assessment of pyrodoxine and describe 4 clinical signs of pyrodoxine derangement. We would like to inform you that if there is any part of the presentation that is not clear to you, at the end we will be happy to assist you in better understanding the content. I know the main or the core question many persons will now be asking is, what is pyrodoxine? I know for me that was the main question until I've done my research and I realized that pyrodoxine is actually one of our essential vitamins needed for our bodies to function well. Now, the term pyrodoxine was coined by scientists mainly because of the presence of the pyridine ring in its structure. It is very important to note that pyridoxine is what is known to us as vitamin B6. This vitamin B6 refers to a family of compounds, namely pyridoxine, pyridoxal, pyridoxamine, and each of their activated phosphate forms. Now, 2 of the well-known activated forms of vitamin B6 are coenzymes pyridoxal 5-phosphate and pyridoxamine 5-phosphate. A second fact about pyridoxine is that it is one of our essential vitamins. Now, what does this mean? It means the vitamin also plays a major role in the final step of chemosynthesis, where it incorporates iron into protoporphyrin. I trust that from our anatomy class that you remember that when glucose is in excess, the body actually stores glucose as glycogen in the different muscle tissues so that it can be used when glucose is in short supply. Now, when the body finds itself in a state where glucose is in short supply, what the body does is to break down glycogen molecules into glucose. This is facilitated by an enzyme called glycogen phosphorylase, and this glycogen phosphorylase is actually an enzyme which depends on pyridoxal 5-phosphate to agilize the alpha-1,4 glycosidic bond to generate glucose 1-phosphate. The vitamin also plays a major role in the final step of chemosynthesis, where it incorporates iron into protoporphyrin. I trust that from our anatomy class that you remember that when glucose is in excess, the body actually stores glucose as glycogen in the different muscle tissues so that it can be used when glucose is in short supply. Now, when the body finds itself in a state where glucose is in short supply, what the body does is to break down glycogen molecules into glucose. This is facilitated by an enzyme called glycogen phosphorylase, and this glycogen phosphorylase is actually an enzyme which depends on pyridoxal 5-phosphate to agilize the alpha-1,4 glycosidic bond to generate glucose 1-phosphate. Pyridoxine is also useful in the metabolism of amino acid. In its phosphorylated state, it plays an important role in the biosynthesis and the degeneration of amino acid. Now, the vitamin is used in a reaction called transamination, and this is simply where, by forming an amino acid pyridoxal 5-phosphate base, an amino group is transferred to a keto acid to form new amino acid. There is also the function of pyridoxal 5-phosphate dependent enzymes in amino acid metabolism that has significant indirect impacts on secondary metabolites that depend on amino acids as their precursors. Now that we know the different functions of pyridoxine, let us now look at the different foods that we can obtain pyridoxine from. Now our table shows that potato, when boiled at least 1 cup, that you can obtain 0.4 milligrams of pyridoxine, and this would account for at least 25% of the recommended daily allowance for pyridoxine. And also for banana, 1 medium-sized banana could provide you with 0.4 milligrams per serving, or 25% of the recommended intake of pyridoxine. For tuna, at least 3 ounces of freshly cooked tuna can provide you with at least 0.9 milligrams per serving of pyridoxine, or 53% of the recommended intake of pyridoxine. I know you may have heard of the old saying, too much of one thing is not good enough. Yeah, I know that pyridoxine is very important to the proper functioning of our bodies, but also we have to be mindful of how much pyridoxine we do consume based on our age, our gender, and also in situations where we are pregnant or we are even breastfeeding. The table projecting is a summary of the recommended dietary allowance for pyridoxine. As you can see, it is based on our age, our gender, and in cases of pregnancy or if we are lactating, as I mentioned before. Now, if you pay close attention, you will realize that as our age progresses, so does the recommended intake for pyridoxine. And in cases of pregnancy or breastfeeding, the recommended intake for a woman increase above normal. Let us think critically. Why would a pregnant woman need to consume more pyridoxine than an ordinary woman? Now, if you are thinking about the physiological changes of the woman and also the metabolic demands of the embryo or fetus, then you're on the right path. We mentioned earlier in our discussion that pyridoxine is essential for the creation of some of our neurotransmitters, and our neurotransmitters are a part of our nervous system. So therefore, it is very essential for a pregnant woman to consume foods containing pyridoxine because her nervous system depends on the pyridoxine as well as the developing nervous system of the fetus or the embryo. Here's a fun fact. Doctors recommend giving pyridoxine or vitamin B6 when women experience what is called morning sickness or nausea or vomiting. It is said that pyridoxine actually controls this feeling and helps them to feel a lot better. Pyridoxine also prevents several complications, which includes eczema and low birth weight. Now over to the lactating woman. After giving birth, mothers are normally encouraged by their pediatrician to exclusively breastfeed their babies, and this is mainly because breastfeeding is said to contain the adequate amount of nutrients needed for the baby's growth and development. Now, on the table, if you look at the stage of pregnancy and the stage of lactation, you will realize that there's a slight increase. This is mainly because pyridoxine intake produces a rapid increase in breast milk concentration. And also at this stage, we have to remember that the babies are not fully developed. So pyridoxine is still needed for the baby's nervous system to develop, as well as the creation of red blood cells that we mentioned earlier in our functions.
Biochemical clinical assessment of pyrodoxine. Now, pyrodoxine, otherwise known as vitamin B6, can be tested using a blood sample or a urine sample. Now, remember, guys, when Sir told us that blood can be separated using a machine called a centrifuge? Now, after the centrifuge separates the blood, vitamin B6 can be tested in the plasma of the blood, or the erythrocytes portion of the blood, that is the red blood cell, as we know. Clinical signs of pyrodoxine derangement. Deficiencies in vitamin B6 can lead to, on my first slide I have skin rashes called seborrheic dermatitis and cracked sword lips called chelosis. The rashes are also itchy, often on face, neck, scalp, and upper chest. This is because vitamin B6 helps to synthesize collagen, which is needed for healthy skin. On my second slide of deficiencies, I have sore glassy tongue and also tiredness and low energy. Now, sore glassy tongue, it can also be swollen. It is called glossitis It is due to loss of papillae, and this can cause problems chewing, swallowing, and talking. Supplements of vitamin B6 can correct this. Alright, tiredness and low energy. This is because vitamin B6 helps to make hemoglobin, the protein that is in red blood cells, that helps to carry oxygen through the body. And if the cells do not get enough oxygen, it can lead to anemia. On the last slide of deficiencies, I have vitamin B6 pyrodoxine deficiency can lead to depression and seizures in the young. This is because pyrodoxine is involved in making neurotransmitters such as serotonin and gamma aminobutyric acid, which both help to control anxiety, depression, feeling of pain, and also it inhibits nerve transmission in the brain, calming nervous activity. Before we end, we have placed some questions for you guys to answer to see what you have learned, and the answers are in the notes section, so you guys can look in the notes section for the answers. This is the end of our presentation.